Hello all. In this video we are going to discuss about acquired immunodeficiency syndrome, which is caused by human immunodeficiency virus. Let's see what are the topics we are going to get covered. First, infection and other complications. Second, women and HIV. And that, prenatal consideration and breastfed infants. Then, pediatric considerations. And third one, relationship between AIDS and malnutrition. And then, dietary management. Before getting into these contents, now let us quickly know that how HIV infects the human body. First stage is binding. Whenever the HIV enters the body through seminal fluid or any other fluid or blood, it first goes and binds to the CD4 cell because it is our immune boosting cell, which is also white blood cell, which fight against infection. So likewise the fighting session takes place inside our body, and this stage is quoted as binding. And second, as the fight starts, the HIV virus fuses with the cell membrane of the host cell, which allow its content into the host cell like proteins, integrase, reverse transcriptase and its RNA. It will just push all these contents into the host cell, and this stage is quoted as fusion. And followed by that, as the reverse transcriptase is pushed into the host cell by the virus, the reverse transcriptation takes place inside the host cell, in which HIV RNA is converted into DNA using the enzyme called reverse transcriptase. And followed by that, integration takes place. So as these integrase enzyme is also entered into the host cell, it allows HIV DNA to be integrated into the host cell, and then replication takes place. HIV can now produce long chain of HIV proteins which can be used to build more HIV. As the fight starts, and it is now in the place of replication, so the hands of the HIV were high. So next what? Assembly. So HIV proteins and RNA move to the surface of the cell and are assembled into immature HIV. And then budding, the last final stage. This immature HIV is pushed out of the cell, and proteases activates this immature into mature infections of HIV, and that's how it spread all over the body. It should be noted that all the HIV will not cause AIDS. If it is diagnosed in the first stage itself, AIDS can be preventable. And there are three stages of AIDS. They are early stage, intermediate stage, and late stage. In early stage, it is asymptomatic and there will be no weight loss or weight loss less than 5%. And at intermediate stage, it is early symptomatic and weight loss could be greater than 5%, and the patient will encounter failure to thrive, which is more like anorexia. And the later stage, it is full blown stage. The weight loss will be greater than 10% and complete muscle mass will be there. There are complications in HIV, like it will leads to easily affects the body because the CD4 which gets damaged. Like all the other bacterial, viral and fungal infections will cause opportunistic infections like candidiasis, meningitis, etc. It is because that our immune system will get collapsed, and if the HIV load is high in the blood, then it will worsen the condition by decreasing the CD4 cells. So it is necessary to start the ART as soon as possible, which is antiretroviral therapy. Associated with it, there are also other complications in HIV, and these complications are wasting syndrome because of chronic diarrhea, fever, and weakness. The neurological complications, which cause neurocognitive disorders from mild to severe, which even causes dementia and causing weakness and inability to function of the brain. Then, kidney disease. it will cause nephropathy, where the tiny nephrons will get inflamed and the kidney will suffer to remove the impurities from the blood. And then liver also gets affected. As the liver, if it is get affected by hepatitis viruses already, then it will worsen the condition more and more, because the AIDS patient will be already consuming a lot of medication, and the liver will suffer to eliminate it from the body. So in that case, if it is already hepatitis, then it will worsen the condition. Women and HIV. Why women and HIV? Out of four, one is affected by HIV, and this is possible because of her male partner and unsafe sexual practices. It can be also spread because of sharing needles, syringe, and other drugs. So, what puts in more risk? It's prenatal transmission. Women with HIV take HIV medicines during pregnancy and childbirth to reduce the risk of prenatal transmission of HIV, to protect their and also to their own health. And this prenatal transmission may affect the child and put the child in more risk of HIV transmission. So what happens if she breastfed the child? Yes, although art substantially reduces risk of transmission through breastfeeding, it does not eliminate the risk, though it may control. But if HIV mother is supposed to breastfeed the child, then through the breast milk, it is possibly goes and affect the child and cause this transmission to the child. So, what can be done to stop this is, like, other donors of breast milk, and or otherwise we can go to the formula feeds for the children, because we all know that breastfeeding is really an important thing for a child. If it is then low birth weight or premature baby, it is necessary to breastfeed the child, but a HIV mother cannot breastfeed the child because it can be transmit to the child though she is in her medications. Pediatric consideration in HIV. It is mandated to start aggravating treatment as soon as the infant is diagnosed with HIV. So, a very good example for this is a study conducted by Wiley et al., a 9-year-old South African girl, and it is a third case of long term pediatric HIV remaining after short term antiretroviral treatment. And this girl is diagnosed with HIV at her 32nd day. So she at the initial is loaded with viral copies of 7,50,000 per ml. The viral load dropped to 1,51,000 copies per ml at her immediate treatment, and at initiation of antiretroviral therapy, and soon dropped to 915 copies per ml. And 40 weeks later, the viral load has below of 20 copies per ml and remaining undetectable to date. So, as soon as they diagnosed and start the medication, so that it is possible to control the human immunodeficiency virus inside the body, and so that we can fight against AIDS in our society. Relationship between AIDS and malnutrition. So it is a vicious cycle. Like, a malnourished people will get easily affected to HIV virus, and the HIV people will go to malnourishment. As we are speaking here about wasting of the muscle. So this HIV, we know that it goes and bind to the CD4 and affects our immune system and collapse the immune system. So as the immune system gets collapsed, all the other viruses will encounter, and there will be a chronic diarrhea and fever. We have already seen that. So it all leads to a possible muscle wasting and leads to undernourishment of a patient. So it is a mandate to give more amount of calories to these kind of people to achieve the balance basal metabolic rate of their own body itself. Dietary management. So for early stage, the energy requirement should be more than 10% of recommended dietary allowance, and the protein can be given 1 to 1.4 gram per kg. And for the intermediate stage, the energy should be 20 to 30% of energy requirement should be high, because the greater than 5% of weight loss will be there as we seen earlier itself. Then the protein should be 1.5 to 2 gram per kg to have a fight against the hospital acquired infections also, because the, as I said already, the opportunistic infections will also be there. So have a persistent fight, the protein should be given in a considerable amount. This patients will also have mucosa membrane infection in the respiratory tract and skin infections like rashes. And at the later stage, the energy requirement should be 30% and more from the recommended dietary allowance, because these people will easily get pneumonia, candidiasis, which is an fungal infection, tuberculosis also will be there for these patients. And the protein should be more than 2 gram per kg body weight to maintain these kind of infections. Beyond this, colorful vegetables, which is rich in antioxidants, can be concentrated more on these kind of patients. There are no specific elimination diet for these people, so they can eat everything. So, what could be the problem? The most challenging thing is that they can eat all, but they cannot be able to eat things. They will be mentally and physically will have lot of damages. So, the meal should be separated into a small meals and should be distributed to the patient, and he or she must not be forced. If it is possible, then the parental and enteral nutrition will also can be done at the most of need. It should be noted that the equity is more important than the equality of when treating with the patients, because each and every one will have their own specification. So let's conclude it. We people should have that in mind, that we can hate the disease but not the deceased. By shaking of hand, the AIDS won't get spread. So treating patient in a good manner is also a very important thing. And this is Helena. So hope you all get good information